Hello, my name is Dr. Ominde, and in this series, we are going to discuss the anatomy of the knee joint. So again, as any joint, you need to classify, know the articulating surfaces, the stability factors, the movements and the muscles that cause the movements, the relations of the joint, neurovascular supply, and applied anatomy. So you need to know these parts of the femur, that's the medial epicondyle, medial condyle, lateral condyle, lateral epicondyle. This is the posterior surface, this is anterior part. So you have your patella here, patella surface of the femur. These are the posterior parts of the patella. Remember, the lateral surface is usually larger than the medial. On the anterior part of the tibia, you have your tibial tuberosity, the medial condyles, the intercondylar eminence, the Gardis tubercle. You need to know what inserts at the Gardis tubercle. Then this is the proximal tibiofibular joint, and we have a distal one. Remember, it's a syndesmotic or fibrous joint with minimal movement. This is the lateral surface of the fibula, anterior crest of the tibia. The tibia has three surfaces: medial surface, lateral surface, and posterior surface. Okay, so this is your posterior surface. This is your soleal line. This is the head, the apex, the head, the neck of the fibula. Okay, so you need to have this in mind. So again, you need to know we have a patella tendon here, your patella, your pre-patella bursa. So, and pre-patella bursa is in front of the patella. Then we have infrapatellar bursa here. We usually have a suprapatellar bursa. That's your femur, and remember it's a synovial joint. The knee joint is a synovial joint. So basically, you need to have this in mind. The semilunar cartilages are the menisci. These are the cruciate ligaments, which are intracapsular but extra synovial within the capsule but outside the synovium. Okay, so this again, patella articulate to the patellar surface of the femur, then the medial condyles of the femur with medial condyles of the tibia, okay, then the lateral condyles of tibia with lateral condyles of the femur. So those are the articulating surfaces. And then you have your menisci here, you have your cruciate ligaments and your collateral ligaments. So the collateral ligaments, medial and lateral, are extracapsular, while the cruciate ligaments are intracapsular but extrasynovial. So you have an anterior cruciate and posterior cruciate ligament. The knee is a complex joint and it's a modified hinge joint. So hinge because it allows movement mainly on one axis, but there's some slight, that is flexion extension, but there's usually some slight medial and lateral rotation. So structurally, the knee joint is a complex joint made up of synovial condylar between the condyles of the tibia and femur, so lateral and medial, and synovial sella or saddle, that is the patellofemoral, between the patella and the patella surface of the femur. So you have the weight being transferred from the medial condyles of the femur to the medial condyles of the tibia, but we also have the saddle patella and the patella surface of the femur, which form the saddle joint. So the patella is a sesamoid bone that is within the quadriceps femoris tendon. What are the functions of the patella? It protects the patellar ligament, okay, as it crosses the knee joint, and also it serves as a pulley. Okay, that way you're able to increase the angle of pull. So there's a greater mechanical advantage in the knee extension. So those are the two functions of the patella. Remember, the action is by quadriceps and the load is the leg. So patella is at the center, is a fulcrum. So it acts as a pulley to increase the angle of pull. Therefore, there's a greater mechanical advantage in knee extension. And the patella protects the patellar ligament as it crosses the knee joint. So this is your patella within the tendon of quadriceps, and you can see the quadriceps will contract and pull like this, and it cause extension at the knee because the leg will move towards that direction. So these are your articulating surfaces. So you have, look at the lateral articular surface of the patella and the medial. The lateral is larger. So it's a sesamoid bone within the quadriceps tendon. It usually has a base superiorly and an apex inferiorly. And the anterior surface is rough. Posterior surface is smooth with two articular surfaces. The lateral being larger than the medial. So that's how you describe the patella in your viva, medical students. Then this is your fibula, this is your femur. Look at the medial condyle of the femur is usually narrower and longer than the lateral condyle, and that's important in the locking and unlocking of the knee. These are your cruciate ligaments, intracapsular and extrasynovial, and these are your collateral ligaments, medial and lateral, which are extracapsular, and these are your semilunar cartilages or the menisci, the medial menisci and the lateral menisci. So the capsule of the knee usually is attached at the margins of the articular surfaces, and usually this capsule communicates with the suprapatellar bursa, and posteriorly the capsule of the knee is perforated by which muscle? Popliteus. So what reinforces this capsule of the knee? On each side you have medial and lateral collateral ligaments. Okay, as we have seen, the extracapsular. Then anteriorly we have the patellar ligament. Then on each side of the patella we have what we call patella retinacula. So on the medial aspect we have the fibers of vastus medialis. They curve to pull the patella medially. That forms the medial retinacula. And on the lateral aspect we have fibers of vastus lateralis that form the lateral patella retinacula. Posteriorly, the capsule of the knee is reinforced by the oblique ligament, and this is an expansion from the insertion of the semimembranosus. So you can be asked to write about the capsule of the knee, and you need to be able to state that it's attached on the articular margins, it communicates with suprapatellar bursa, it's perforated posteriorly by the popliteus muscle, and reinforced on each side by medial and lateral collateral ligaments, anteriorly by the patellar ligament, and on each side of the patella, we have the patella being kept in position by the medial and lateral patella retinacula, which are expansions from vastus medialis and lateralis. And then posteriorly, the capsule of the knee is reinforced by the tough oblique ligament, which is an expansion from the semimembranosus. So all these reinforcements together with the capsule, these are the stability factors of the knee joint. Okay. So this is what we are discussing. Here is your arcuate popliteal ligament. Here is your oblique popliteal ligament from the semimembranosus. Here is your medial collateral or tibial collateral ligament, lateral collateral ligament. And you can appreciate the bursa that we find in the knee. We have a bursa around semitendinosus, a bursa around the lateral head of gastrocnemius, bursa around biceps femoris, okay? And just appreciate the ligaments at the knee, and these are what ensure its stability. Anteriorly, you can see your quadriceps and the sesamoid bone within the tendon of the quadriceps as your patella tendon. Now, these are the retinacula we're discussing. Laterally and medially, okay? So you have your vastus medialis and lateralis, the fibers, they turn towards to face the patella, and those are your they send the fibers, and you can see these are your retinacula at that portion. So stability of any joint, you talk about the congruence of the articulating surfaces. So the condyles of the femur are able to fit on the concave condyles of the tibia. And we also have the menisci, which are fibrocartilages at the knee. They help to increase the congruence of the bone. We have the ligaments, which we've talked about, patella ligament, medial collateral ligaments, we've talked about oblique ligaments. All those, plus the capsule, they're able to reinforce the stability of the joint. And then we also have muscles that are crossing the joint. They offer stability. So we have the menisci. Menisci are fibrocartilaginous fibrocartilage that are located in the knee, and there are two, medial and lateral. What are the differences? The medial menisci is usually attached onto the medial collateral ligament. It is C-shaped and it's less mobile. Therefore, it's more frequently injured. Less mobile, so frequently injured. The lateral menisci, on the other hand, is more mobile and less frequently injured, and it's O-shaped. So those are the differences. Medial is C-shaped, lateral is O-shaped. Medial is attached to medial collateral ligament, therefore it's less mobile and more frequently injured. The lateral does not attach onto any ligament, therefore it is more mobile and less frequently injured. So this, you can see this and this, C-shaped medial and O-shaped, almost O-shaped lateral. And this medial usually attaches onto medial collateral ligament and anterior cruciate ligament, which we shall discuss. But this is your lateral. Here is your anterior cruciate. So you can see those are the menisci. Medial is C-shaped, lateral is O-shaped. Again, medial is C-shaped, lateral is O-shaped. Medial attached to medial collateral ligament and anterior cruciate ligament. Okay. So again, this is the posterior aspect of your joint. How do I know it's posterior? The patella is not there. Okay, so you can appreciate this is your lateral meniscus, O-shaped, mobile, less injured, medial, C-shaped, attached to tibial collateral, so it's less mobile and frequently injured. What are the functions of the menisci? Number one, they provide stability of the joint. How? Because they increase the congruence of the bone. They deepen the concavity of the tibial condyle. The menisci also distribute synovial fluid. And when you distribute synovial fluid, there is smooth movement of the joint. Menisci also help to distribute forces from the femur to the tibia. And the menisci also help in absorption of shock. So it's made up of fibrocartilage, and from your histology, you know the features of fibrocartilage. It lacks perichondrium. It contains collagen type 1. Cells are single, arranged within lacuna, arranged in parallel rows, and then the collagen type 1 fiber is visible. Okay, so those are the features of fibrocartilage. So what is the blood supply to the menisci? The peripheral portions of the menisci have some vessels that supply them, but the central portion lack vessels. So when you tear your menisci, if the tear is on the peripheral aspect, we call them red tears because the vessels that are the peripheral will rupture, causing bleeding. So those are red tears. And if you have a tear on the central portion with no vessels, those will be white tears of the menisci. The ligaments at the knee, which are stability factors. So we have medial collateral ligament, which is a tibial collateral ligament, connects the medial condyles of femur to medial condyles of tibia. Usually they attach onto medial meniscus, as we have said, and the medial collateral ligament merges with the joint capsule. Then we go to the lateral collateral ligament, again attaches lateral femoral condyle to the head of the fibula. This does not attach onto the capsule or the meniscus. Okay. We have the oblique popliteal ligament, which is an extension of insertion of semimembranosus. This merges with the capsule. Then the arcuate popliteal ligament, which is an extension of biceps femoris. So you need to know this because in your MCQ, I'll ask you, oblique popliteal ligament is an extension of biceps femoris. That's false. It's from semimembranosus, and arcuate popliteal ligament is extension of biceps femoris. Then we have intracapsular ligaments. These are anterior and posterior cruciate ligaments. They are intracapsular but outside the synovium. They are extrasynovial. What's the origin of anterior cruciate ligament? From the anterior aspect of intercondylar fossa of the tibia. Then it goes to insert on the medial surface of the lateral condyle. Okay? Remember, posterior cruciate is on the posterior aspect of intercondylar fossa. Anterior cruciate is anterior aspect of intercondylar fossa. That's the origin. Insertion, anterior cruciate on the medial surface of what? The lateral condyle of femur, while posterior cruciate is on the lateral surface of the medial condyle of femur. So you need to be keen about that because your MCQs will tend to confuse you. Medial surface, lateral condyle, medial condyle. Anterior part of intercondylar fossa, posterior part of intercondylar fossa. Okay? What's the function? Anterior cruciate resists forward displacement of the tibia on the femur. So it prevents the tibia from moving forward in relation to the femur, while posterior cruciate prevents the tibia from being displaced backwards on the anterior cruciate resists forward displacement of the tibia on the femur, while posterior cruciate prevents backward displacement of tibia on femur. The anterior cruciate is weaker compared to the posterior. So this slide, I can get a lot of MCQ questions, yeah? So then the cruciate ligaments, we've said they are intracapsular but extrasynovial. So what is unhappy triad? Triad, 3. So these 3 structures usually are connected to each other. Anterior cruciate ligament, medial meniscus, and medial collateral ligament. They are attached onto each other and also onto the joint capsule. So the 3 of them are relatively mobile. So if you injure one, all the 3 of them get injured, and that leads to unhappy triad. Anterior cruciate ligament, medial meniscus, and medial collateral ligament or tibial collateral ligament, unhappy triad. Then we have bursa at the knee, suprapatella above the patella. Then infrapatella bursa, we have 2, the deep and the superficial. Clergyman's knee is caused by inflammation of the superficial infrapatella bursa. The way people kneel down as they pray is the superficial infrapatella that is inflamed. Then we have housemaid's knee, when the prepatellar bursa, as a housemaid is on their knees brushing the floor, the prepatellar bursa gets inflamed. Prepatellar bursitis in housemaid's knee. Clergyman's bursitis, superficial infrapatellar bursa that is affected. Then we have a popliteal bursa, and we have bursa around the pes and serine. Remember I told you pes and serine is a duck's foot appearance of 3 tendons, the sartorius, semitendinosus, and gracilis. So bursa and serina is located there. So these are the bursa at the knee. Then next slide we discuss the movements that occur. Next video we discuss the movements that occur at the knee.